Aku rangatira, tēnā koutou katoa, ka nui te honore ki te mihi ki a koutou. Ladies and gentlemen, well, thank you so much, Bonnie, for the invitation to be here today. Bonnie has given me instructions too that I must try and eat this thing, which is why I'm holding it like this, so I hope that the people at the back can hear me. Caring for older people is a rewarding but sometimes challenging field, and I know that the improved facility here will provide many opportunities and also rewards for all involved. It is a pleasure to be here today. Thank you, Bonnie, again. I would also like to acknowledge David and Matua for the blessing and also for their good work, which will come just a little later. Keith Rushbrook, your board chairperson, and also fellow board members that are here today. Val Segru, who, even though recently retired, has obviously such an important place in this place and has played a very big part. Chris Dunlop, who we've heard is the hospital manager and a wonderful one at that. The Howick Baptist Home and Hospital residents and their families, and the kind ladies who came to sit in the front row when all the rest of you filled from the back. The Howick Baptist Home and Hospital staff, who I just know are doing a wonderful job. The Baptist community who supports this facility. My colleagues, the Honourable Maurice Williamson, MP for Pakuranga, and Jamie Lee Ross, MP for Botany, who have joined us here today to acknowledge the significance of this event and of this place in the lives of the residents and this community. I understand that there are quite a few of the contractors in the middle of the room over here too, and I've heard that you've done an absolutely incredible job, so I just want to actually acknowledge you too, because it's great that was one of the first things I heard once I got here, so well done, and I hear your job's not finished yet. So my congratulations to all involved. I just want to begin by talking a little bit about government priorities. As Associate Minister of Health, the Honourable Tony Ryle gave me responsibility for aged care, something I feel very strongly about and have done for quite some time, and rural health and health cert and public health and a few other things, after which I asked if he'd kept anything for himself, and he said yes, he has, so that's good. We, as a government, are committed to ensuring older New Zealanders are provided with the choice of high-quality care they need. One of the government's key expectations for public health services is the delivery of better, sooner and more convenient care, so that health outcomes are improved for all New Zealanders, most importantly for older New Zealanders as well. The government initiatives to improve health services, specifically for older people, include more money being spent in aged residential care. The government has invested an additional $130 million per year into aged residential care over the last 4 years, with a further $40 million budgeted for residential dementia care over the next 4 years. The comprehensive clinical assessment tool from the Interise suite is being rolled out into aged residential care, and I'll speak just a little more on that in a moment. Also providing greater support for informal caregivers through respite care. An additional $5 million per annum was allocated in 2010 for respite care in general, and then a further $1 million per annum to DHBs from the 2011 targeted at dementia respite care. The Ministry is currently monitoring what DHBs are doing with that money to make sure it's being used to best effect. But we've also introduced mandatory quality standards for home and community support services, combined with regular audits of service providers and a more robust consumer complaints and satisfaction measurement, because we really are true to our word. We do want it to be quality care, and we want to do our bit as a government to help work out just where that quality is and help you, the public, to see that. This will help ensure that high-quality residential care services, such as those provided here at Howick Baptist Healthcare, mean the continuum of care options are available for the older citizens of Howick and are also sustainable. The Ministry is also working closely with DHBs to ensure the provision of wraparound services for older people as part of the integration program. This work includes best practice dementia care in the community, specialist clinical support for primary care providers, smarter home-based support services, and that's about reducing acute admissions to hospital, the introduction of a world-class needs assessment framework, and best practice stroke management in secondary care. Our aim is to keep older people out of the secondary care. That's the hospital acute services and cared for in the community. I know that Howick Baptist Healthcare have been involved in the Integrated Care Project run by Counties Manukau, DHB. That's the Community Geriatric Services, and that's been running since 2007. It is an excellent example of integrating hospital services with community-based care in order to reduce acute hospital admissions. And just recently I visited the hospital and heard exactly how this is working to change the face of how older folk are looked after in their community. I'd just like to briefly mention the Interai implementation. Interai is a comprehensive clinical assessment tool used for assessing a resident's needs and developing a quality care plan. This assessment will support nurses working in aged care by providing an early risk profile of a resident's care needs. Areas of concern will be able to be addressed at the earliest possible point. This Interai implementation began last year and is expected to be implemented fully by 2015. It's a collaborative initiative between DHBs and the residential care sector. The project supports integrated service provision as information from an older person's care home care assessment is available then to the facility to help complete the initial assessment on admission. All healthcare providers, including GPs, will be able to access the older person's information over the internet at each stage of care. Those assessments will happen at least twice a year, but also when there is any significant change in the person's health status. Quality comparisons will later be available in terms of comparing once we have enough on the data set. Over 100 facilities are already involved, and the training of nurse assessors is well underway, as there's plenty of interest from aged care providers in being involved. I understand Howick Baptist Healthcare has been supportive of the initiative, but you're focused for now on your upgrade project. With the opening of the hospital today, I encourage you to now look at making the most of that tool as an additional advantage to you and your residents. The ARC review, or the Aged Residential Care Service Review, was undertaken by DHBs and the New Zealand Aged Care Association in 2010. This was a promise we made at the 2008 election to actually look out and forecast the needs of the aged New Zealanders into the future. So that's long-term needs for aged residential care, workforce issues, alternate models of care, future demand and supply, and the cost of care. So that good work has been done. This was a Grant Thornton report, which was actually, it was announced back in, I think it was August or September of 2010. So we have the information, we have the modelling. And it highlighted the demand for hospital level care has grown and would continue to grow. I think what we see here today is you read the report, you understood, but you also listened to your community and heard that this is where in fact there is a need. The review also identified dementia units, beds and services as a pressing need, and the government is committed to ensuring public health service provides and supports for all people with dementia, but also for their families during a very difficult time in their lives. And I understand that in fact here your day program is tailored to address some of those needs within your community. As part of the annual planning process, DHBs have also been instructed to develop dementia care pathways across primary, community and hospital care services to ensure that people with dementia are better supported to live well within their communities with earlier diagnosis and an integrated service response. I also mentioned that the report talked to us about workforce issues. The government is moving to strengthen the aged care workforce, and you will be pleased, I believe, to hear that in 2011 over 2,700 national certificate qualifications were completed by aged care workers. This number has more than doubled since 2009, and we will continue to encourage it to increase. Last year we also added to our very popular voluntary bonding scheme aged care, nurses working in aged care, and there was quite a lot of interest in that. The future will require people to work differently. Just how this looks is currently being worked on by Health Workforce New Zealand, and I'm following closely with the Ministry of Health people involved in that. Expanded scopes of practice, new roles and skill levels required for primary care workforce are also being considered. So we do need to work on ways to use the current workforce differently. A small number of highly trained professionals in aged care can positively impact on the health and well-being of older people, and we do need to make the most of their skills and qualifications. With the opening of this facility today, you're offering the people of Howick a facility that provides a high quality continuum of care in a very modern environment. I am really looking forward to a tour of the new hospital extension. I want to thank you for the opportunity to be here today with you, to share this occasion with you. I want to congratulate all who have been involved in this very large project. Nō reira, tēnā koutou katoa.
Thank you, Minister, for taking the time to come and talk to us today about what's happening in the political world in terms of services for older people. I spent 10 years working in Wellington, and I think one of the things I have learnt from shifting from working for government to working in the community sector is that actually it only works when we work together, and we'll only meet the needs of the growing population if we work together on solutions. So it's something that we work in partnership towards and walk together on the journey. So thank you for being part of our journey today and sharing with us some of the key things that are happening. So thank you very much.